Hello and welcome to this webinar. Today we'll be talking about healthcare provider wellness in the age of COVID. I want to give thanks to the California Statewide AHEC program and also to the UCSF Medical Education Center at Fresno. So an introduction, my name is Linda Barman. I'm a clinical assistant professor at the Stanford University School of Medicine in Palo Alto, California. I also help to run our Stanford Express Care clinics, which are similar to an urgent care. I also help to run the Stanford COVID-19 clinic, where we take care of outpatients who've been diagnosed with COVID-19. I also helped to start the COVID-19 drive-through testing center at Stanford back in March. And finally, I'm our clinic's wellness champion, participating in the Stanford WellMD program. I have no conflicts of interest regarding any of the topics I'll be presenting today. So, first of all, wellness. I'm talking about wellness, and I, to this day, despite being a wellness champion and someone who gives talks about wellness, and I do wellness workshops across the country, still find it's a little bit of a fuzzy topic to define. Personally, I define it as having physical, mental, social, and emotional well-being, and having fulfillment, meaningfulness, and happiness in your life. However, sometimes it's easier to define what wellness isn't. Wellness is the opposite of burnout. And a lot of times, wellness is measured by surveying for prevalence of burnout. It also is the opposite of having high rates of suicide in the healthcare professions. And in these particular times, healthcare provider wellness, to a lot of us, means being protected and safe from getting COVID-19. There is a definition for burnout. Job burnout, in particular, is a special type of work-related stress with emotional and physical exhaustion that also involves a sense of reduced accomplishment and loss of personal identity. So it's more than being just physically tired. It has a deeper meaning than that. So why do we care? One thing that pushed Stanford to start the WellMD Center was the rates of suicides among physicians. This is obviously a tragedy anytime someone commits suicide. Studies have shown that rates of suicide in male physicians are 40% higher than the general population, while rates of suicide among female physicians are a whopping 130% higher than the general population. We lose 300 to 400 doctors every year to suicide in the United States. Doctors aren't the only people in healthcare. One study in England showed that nurses in England were reported to have the highest rates of suicide of all healthcare professionals. So this is an issue that can affect any of us on the healthcare teams. It's not just a personal tragedy. Burnout also costs our healthcare system an incredible amount of money. Conservatively, it's estimated that burnout contributes to $4.6 billion in costs lost to the healthcare system in the US every year. This is related to physician burnout, decreased work hours when physicians cut back, and medical errors. Fewer studies have been done on nurse burnout, but one study estimates that nurse burnout costs our system $14 billion per year. It is huge numbers we're talking about. Finally, if you're a patient, you should care as well. Studies have shown that physicians that experience burnout and have higher burnout scores commit more medical errors, corresponding and leading to worse patient care. So treating burnout helps all of us. I'm going to move on, and the first about half of this talk is going to be focusing specifically on wellness issues for healthcare professionals during this time of the COVID-19 pandemic. There are many unique stressors during this time, particularly the concern of infection. I'll be talking about them, explaining them, and hopefully sharing some strategies with you. First of all, this is a graph from a study done in England where they had healthcare providers and general population people use an app to report if they had been infected. As you can see, the relative rates of infection in healthcare workers was higher in this study than in the general population. However, one thing I want to point out is there's a huge amount of variability in the rates of infection. These dark areas that you can see, particularly in New England and Louisiana, had rates of up to 5,000 or higher cases per 100,000 healthcare workers. Conversely, in California, our rates are less than 1,000 per 100,000 healthcare workers. There's a huge variation in the rates of infection among healthcare workers. Part of this has to do with this timing of the pandemic. Both New York and Louisiana had large outbreaks early on in the pandemic, before we knew a great deal about COVID-19 and how to prevent infection, before hospitals were necessarily ready with appropriate supplies, trainings, and systems to prevent infection. I like to think of this slide not as something depressing, but as something to give us hope, because we know that we can do things to lower the rates of COVID-19 infections in healthcare workers and push those numbers down to the lower side. Your risk of getting COVID-19 varies greatly. Not only does it depend on where you work and what time of the pandemic, but also depends on your role. Studies have shown that those of us who are practicing bedside care, such as nurses, nursing aides, and care aides, are at higher risk of contracting COVID-19. However, anyone can get it, including pharmacy, security, and environmental services. Therefore, it's important for us all to look out for each other to keep everyone on our healthcare team safe. Rates, like I said, vary widely. One study that was done a little bit earlier on found that a hazard ratio of 11.61 for healthcare workers compared to the general community, but there was a wide range. As you probably know, there's a lot of unique challenges we're all facing during this pandemic that make it difficult to maintain our wellness. One that I'm going to be spending a great amount of time on today is explaining how you can potentially help protect yourself and prevent infections. I help to run our Stanford COVID-19 clinic. We call it the Crown Clinic, where we've taken care of 642 outpatients who've been diagnosed with COVID-19 between April and the end of September. Despite taking care of this large number of patients in the outpatient setting, we have not had a single worker in our clinic contract COVID-19 at work. I hope by sharing some of our strategies, I can give you some reassurance and skills you can use to stay safe as well. Obviously, our personal vulnerability varies greatly from person to person. Some of us may be older, we may have immune system issues, be pregnant, or have an elderly or frail relative at home. One thing we've done in our COVID-19 clinic is we explicitly forbid people over 65 from working in the clinic because we knew they would feel awful not volunteering, but our older workers have an incredible amount of knowledge and experience and are very valuable to our team, and we want to keep them safe. Providers can also present a doctor's note if they need to not take care of patients directly. I am recording this webinar on Election Day, so I do have to mention the political side. We all know that our country is going through a very unusual and very stressful time right now. In addition, our usual leadership on the national level is perceived to be influenced by politics. And a lot of us in healthcare feel somewhat leaderless and rudderless. We also can experience bias and fear from others. We may have family, friends, or neighbors, or other people who think that COVID is a hoax, who don't believe in masks, or maybe even are just scared that they're going to get COVID-19 from us. I myself have one neighbor who is kind of scared to see me and will go the other way if she sees me on the street. I understand her fears, but at the same time, it hurts. I have another coworker whose family doesn't want her to work. They're afraid she's going to bring COVID-19 home. We can have these pulling feelings on us. We want to take care of our patients, but at the same time, we want to keep our families safe. Other family issues. Many of us who have children are having to deal with homeschooling and caring for our children at home because of school closures. We can worry about getting our families sick. Also, many of us may have spouses, significant others, or family members who hours have been cut back at work, or who may even have lost their jobs due to the economic fallout from the COVID-19 impact. That goes on to financial. Not only could our loved ones be experiencing job loss, at many of our healthcare institutions, due to decreased revenue, we may have had our salaries or hours cut. Social, there's huge social impacts on our wellness. We can't go out and see our friends. We can't go to restaurants, go to barbecues, go to parties. And maybe some of the things we used to do to improve our wellness or maintain it, we can't do anymore. I love to run, and there hasn't been any road races all year. The gyms are closed, the pools are closed, many of the parks are closed. And those things can affect us more than we realize. Last of all, and one thing that really has been bothering me since the beginning of the pandemic, is the amount of uncertainty. It's hard to believe because it feels like we've been doing nothing but COVID-19 forever. We've only became aware of this disease towards the beginning of the year. It's been less than a year. The amount of knowledge that we've learned about COVID-19 in such a short amount of time is staggering. At the same time, with the knowledge base evolving so incredibly rapidly, it's very difficult to stay on top of all the knowledge as it comes up, all the new studies, all the new data, all the new recommendations. At the same time, we feel like we need to know all that best data in order to take the best care of our patients. Patients frequently ask us questions that we don't have the answers to. I will share that personally, early on in the pandemic back in March, I had many patients asking me questions about COVID-19. And I remember telling some of them, if you don't have a fever, you don't have COVID-19, don't worry. Now we know that's wrong. Back then, that was based on the studies we're getting out of China showing that the vast majority of people with COVID-19 had a fever. That's because only people getting tested in China at that time were people who were severely ill. I gave my patients the best answers I had based on the data I had at that time, but now I know that I gave them the wrong answer, and that's an issue that still keeps me up at night. I'm going to spend the next amount of time talking about infection prevention, how to keep yourself safe from COVID-19. I'm in charge of infection prevention in our COVID-19 clinic. I'm a germaphobe. I love to talk about this. Like I said, so far, knock on wood, all of my coworkers in my COVID-19 clinic have been safe, and I'm hoping you can stay safe too. The number one thing to remember, well, number two things to remember about infection control, it works, but you have to be consistent. Like I said, despite taking care of 642 patients with COVID, none of us have gotten COVID at work. We know how it's spread. COVID-19 is a respiratory disease. You're going to get it from breathing in, or you're going to get it from getting it on your hands and then touching your mucous membranes, your eyes, your mouth, your nose. Once we know how it spreads, which we do, we know how to prevent it. In order for you to be safe, though, there's some things you need to have in place around you. The first I'll talk about is supplies. And we all think about this because we've all seen in the news, especially early on, people having shortages of PPE, having to reuse N95 masks for large amounts of time, using ski goggles and garbage bags because they couldn't get PPE. Fortunately, things have improved greatly, but it's still important that we have the supplies that we need to keep us safe. Not only our masks, but our face shields, our sanitizing wipes, our gloves. Systems are equally as important, even though they're not as visible. Systems are things like having everyone come in through one entrance so a screener can check them all. Making sure that every single person is giving a mask when they check in. Making sure that we know where to go and what to do if we have questions about COVID. All those are very important to have in place as well. Knowledge is important. And not knowledge, well, it is important, the knowledge it's in the journal and in the lectures, but knowledge on the fundamental level. You, as a healthcare worker, need to know what you need to know how to keep yourself safe. You can have the best N95 in the world. If you don't know how or when to use it, it's not going to do you any good. One of my goals for the talk is to hopefully give all of you some of that knowledge to keep yourself safe. Finally, I think one of the most important things is consistency. We are human beings, and it's really hard to keep up our guard for so long. In the beginning, we're all super vigilant. And after a while, it's easy to slack off and maybe not wash your hands quite as much. Maybe you take your mask off when you're having lunch with a friend. Maybe you hug your coworker. We need to do the same thing the same way every single time. I'm going to go over hand washing right now. And I know hand washing seems silly, but most of us and most of you are probably not doing it right. I need to pause for a moment here and go get my hand sanitizer. I'll be right back. Okay, I am back. So we're going to talk about hand washing. Hand washing is one of the best things you can do to keep yourself safe. Masks, wear your mask all the time. I don't care who you're with. If you're with someone outside of who you live with, you wear your mask. Social distancing, staying far away from each other, even at work, even with your coworkers. and hand washing as well, because we all touch our faces a lot more than we realize. Hand washing helps prevent not only COVID-19, but all kinds of other germs. The problem is most of us don't wash our hands right. I don't know about you, but I myself was guilty of I'm good. I'm going to show you how to wash your hands. And then we're going to watch a video about why we do it that way. And then we're going to wash our hands again. And I say we, because I want you to do this with me. You're watching a webinar. It's an hour long. It's really boring. This is going to make it more interesting, and it helps give you that muscle memory. If you practice, you're going to do it better. We usually do these in hands-on, in-person workshops, but obviously this is a webinar, so I got to trust you're going to do this with me. This seems silly, I realize it. If you're only going to do one thing today, learn one thing today, this may be the best thing. And once you learn how to wash your hands correctly, you're going to feel gross for the rest of your life doing it any other way. You'll be able to imagine the germs on your fingers. So obviously, first thing with hand washing. So when I work, first in the COVID-19 clinic, we don't wear watches and we don't wear rings because it makes it harder to get your hands really, really clean. I leave my rings at home because I lose things all the time. I would lose them in clinic. So I'm going to go into my COVID-19 clinic, my COVID-19 room, no rings, no watches. Okay, you're going to get your soap, your hand sanitizer, either one's totally fine. If you do that amount, that's not enough. Give yourself about that. And okay, I'm serious, do this with me. If you don't have hand sanitizer, pretend you do. Watch what I do. You're going to rub your palms together up to the fingertips, the back of your hands. And then you're going to do the back of your hands together with your fingers together and then fingers laced. And then you're going to switch back of the other hand together apart. Then you're going to do what I call chicken fingers, getting your fingertips. Then you're going to get one thumb in your hand, one thumb. Then you're going to get your tips and your cuticles, and get all the way to your wrists. So once you get used to it, it only takes about 25 seconds, and you're going to get every surface. Our hands are actually really complex structures. If you think about it, you have, even on a finger, you have the palmar side, the back, one side, the other side, the fingertips. There's a lot of surfaces. I'm going to show you a video that I find to be really, really explanatory about why we wash it the way we do. In this video, they use black ink to help demonstrate where the hand sanitizer would be. And you can see with the white gloves everywhere that you would not be getting. So in this case, put your hand sanitizer in, you're rubbing your hands together, and you're like, I'm great. Oh my gosh, the sides of the fingers are not so good. And the backs, get on the backs of the hands with the fingers interlaced to get the sides of your fingers. I'm doing great. Oh my gosh, my fingertips are terrible. You do that, what I call the chicken elbows with your fingertips. You're like, I'm actually really good. Oh my gosh, my thumbs are still not good. So you're gonna get your other thumb. We do our fingertips and our cuticles because that part of our hand have little ridges and bumps. We don't want to miss it. Good. Finish off with your wrists. Okay? This is, if you want to show anyone in your clinic, it's literally on YouTube. It's called the Black Ink Hand Washing Video. I show it to everyone that comes in my clinic, and it's really an eye-opener. Okay, so we're going to practice it one more time. And like I said, if you only do one thing, this is the best thing you're going to do to stay healthy. So hand sanitizer on. Palms of your hands together, from the bottoms of your hands up to your fingertips. Backs of your hands together, fingers interlaced. Backs of your hands together, fingers interlaced. Get your thumbs, get your thumbs, get your fingertips. Get your tips and your cuticles, all the way to your wrists. And I will say it doesn't really matter the exact order that you do it in as long as you do all those steps. So now you know how to wash your hands, right? If you think about how you've been washing them all your life, you can just imagine all those areas that you weren't getting. Okay. So I'm going to walk you through how I do things at our COVID-19 clinic. Like I said, I'm in charge of infection prevention there. Highly supported by the Stanford Infection Control Department, which is incredible. But I'm going to tell you what I personally do that's worked for us. First of all, like I said, when I work in the COVID-19 clinic, rings and watches stay at home. We have our hair pulled back. When I first walk into clinic, the first thing I do before I even put down my backpack or anything else, I put on some gloves and I wipe down my workstation with SaniCloth wipes. Any kind of sanitizing wipes, bleach, whatever you have you're using in your clinic. Wipe down anything you touch. I wipe down my chair, I wipe down my desk, my phone, my computer keyboard, my mouse. I also wipe down the door handles, the handles on the soap dispenser, and the surface of the counter where I might be laying down papers. We ask that everyone in our clinic do that when they first come in. You clean anything you're going to touch, like I said, including door handles, soap dispensers. And at the end of your day or before you leave your shift, you do the same thing. In addition, you do not eat or drink in clinic, which leads me to another issue I'm going to talk about in a moment, hydration. You really can't eat or drink without taking your mask off, and it's not safe to take it off when you're in the clinic. We do have what we call a hydration station where you can keep your water bottles in a cabinet. If you're going to eat or drink, we go outside. We actually took our interior lunch break room. We got rid of it. All the furniture is out. There was one outbreak in our area, not in my clinic, thankfully. 3 people got COVID at work. They got it from each other. Turns out someone was at work. They were pre-symptomatic, had lunch in the break room with their friends. You got to take your mask off to eat. They weren't 6 feet apart. They were indoors, and 3 of them ended up testing positive for COVID-19. So we shut down our lunchroom, unfortunately. We put a bunch of picnic tables outside, put green stickers where you can sit and red stickers where you can't. So it's public shaming if anyone sees you sitting where there's red stickers. You got to go outside. You got to eat. You got to go outside to drink. Problem with that, if you're wearing your mask all day and you can't drink in your room, you're going to get dehydrated. So I set a timer on my phone, and halfway through the morning, you go outside, you take off your mask, you chug a bottle of water, lunch bottle of water, afternoon the same. And I'm working at the COVID-19 drive-through. We all have scheduled breaks every 2 hours. And if needed, I will chase my coworkers outside and make everyone drink. We see too many nurses with UTIs and kidney stones from not drinking enough water. So it's important to make sure you're staying well hydrated despite wearing your mask all day. Also in our COVID-19, we do wear full PPE when seeing patients. We have an N95 face shield, gown and gloves, like a lot of us do. Personally, our standard is you can reuse the same N95 for the shift as long as it's covered with a face shield, but if it becomes grossly contaminated, you have to throw it out. We have all patients call when they arrive to clinic, and then we go get them one by one and bring them in a back entrance so they're not coming in an elevator or a waiting room. We also try to minimize how many people are going in and out of the rooms. So I, as a provider, I'm a physician. If I'm the last person in the room, I clean the room. I disinfect it, wipe everything down. Because if someone else has to put on PPE to go in to clean the room, that's another set of PPE and another person who's potentially exposed. So that's what we do. It works very well for us. I'm going to talk about some strategies and some other strategies. First is stuff that all of us should be doing, and then some other strategies for those of us who are managers or directors or have other leadership responsibilities. The first of all is what I consider COVID-19 version of universal precautions. Most of us should know what universal precautions are. Many of us have been trained in that. That's assuming that everyone has a bloodborne illness. We always wear gloves when dealing with any kind of body fluids. We're always washing our hands before and after patients. Where I work at our express care clinics, part of our universal precautions before COVID-19 was putting a mask on anyone who had a cough, cold, or fever, and having anyone working with them wear a mask as well. Early on, back in March, we had a family come in with a fever, who we later found out had COVID-19. This was early on before people could get tested, and several of us were exposed. Fortunately, because we followed our universal precautions of masking everyone who had any kind of cold symptoms and wearing a mask ourselves for those cases, none of us ended up testing positive, which I'm very, very grateful. For COVID-19 universal precautions, I encourage you to assume that every person you interact with has COVID-19, whether they're symptomatic or not. We do know that asymptomatic people are a big driver of the COVID-19 spread. Oh, and I mean, don't just assume your patients have it, because we all are pretty good at that with our patients, right? We're washing our hands and we're wearing our masks. But not just them, anyone around you, including your coworkers, people on the street, people at the store. Don't let your guard down. Like I said, assume everyone has it. These days, all patients and healthcare workers need to be masked. Unfortunately, if you're working in a clinic, you got to wear your surgical mask all day long unless you're outside more than 6 feet away from other people. I think it's really important also to speak up because we are all in this together and we're all in a clinic together. We can all help each other out. It can be hard, especially for some of us, to speak up when we see someone maybe having their mask around their nose or getting a little too close to us. You know, you have that person that's like a little too friendly, a little too close, and you're like, oh my gosh, 6 feet. And it can be hard to speak up. We did a little game at our COVID-19 clinic early on that you might want to think about that brought attention to this in kind of a fun way. There's a game you might have done if you've ever gone to a baby shower where everyone gets clothespins, or about 5 clothespins you can put on your shirt. And if you say the word cute or baby, whoever catches you gets to steal your clothespin. And whoever has the most clothespins at the end of the baby shower gets a prize. We did something similar in our COVID-19 clinic. We give everyone 5 paper clips at the beginning of the day to put on their name tag. And if any of your coworkers saw you with your mask off, hugging people, drinking or eating in clinic, not following our regular protocols, you got to steal a paper clip. And by the end of the day, the person who got the most paper clips got a prize. It was a way to have us get used to calling each other out in a fun and a positive way. To this day, I'll still remind people, hey, you're too close. Your mask is kind of drooping down, but we can do it in a positive way too. Hey, I want you to be safe. I value you. I want you to be safe. And I do want you to be safe. One of the things that's also very important is looking out for each other. We are all in this together. In our clinic, we have a buddy system for PPE. It's similar to what I learned when I trained for scuba decades ago. You have a buddy. You get all your stuff on before you go in the water and you go down under. Your buddy checks you out one last time to make sure you have everything on right. It sounds simple, but we do the same thing before we go into a patient's room with our full PPE on. We put all it on, we put all our gear on, and then I ask one of my coworkers, hey, am I good? And I kind of spin around, do the quick 360. And they'll say, oh, your gown's open and back. Hey, you know what? Your sleeve is kind of gaping down. One time I almost walked in a room without my face shield, and I could have been coughed on. So take the couple seconds, have your buddy check you, you check your buddy. We're all in this together. Look out for each other. We're all worried. I showed you that map earlier with the black states in England. We're all really, really scared about getting COVID-19. The fact of the matter is a significant number of healthcare workers who get COVID-19 get it from social situations. This has been shown in multiple studies and also what we've seen at my own institution. We've had several cases of people who got it at barbecues with family members. And like I mentioned, the cases earlier in the work break room. Be careful in your social situations, as careful as you are in work in order to stay healthy. If you have a leadership or manager or directorship position, you also have a lot of influence as well on the safety of the people around you, which then directly impacts their wellness. One of the most important things in these scary times is transparency. As much as you can, be transparent as possible. There's a saying that sunlight is the best disinfectant. And a lack of transparency leads to distrust, which can lead to fear. At my institution, we get a weekly email with all the statistics. How many tests the lab ran, how many % tested positive, how many COVID-19 patients are in the hospital and the ICU, how many employees tested positive, what is our supply chain looking, how many masks do we have left, gowns, supplies, all those other things. It really keeps me reassured to know that I know exactly what's going on. Leading by example is incredibly important as well. If you have any leadership role, what you do, as we know, is going to be much more important than what you say. If you are drinking your coffee in clinic and taking your mask off, your coworkers will think it's safe to do so too. Or they might feel embarrassed or ashamed to remind other people when they're doing the wrong thing. Not only do you need to be the best example of wearing your mask and social distancing at work, remember you're also going to be an example for everyone in your social circle who knows you work in healthcare. If they figure you know more than they do about COVID. And if you're not following social distancing and masking, they're going to think maybe it's not that big of a deal. We lead not just by doing the boring social distancing and masking and hand washing, but also by what we do when we get sick. All of us in healthcare, but especially those of us who have managerial roles, feel like we're indispensable. Healthcare workers were notorious for going into work with migraines and UTIs and bad backs and all kinds of stuff. I want you to be an example and a good one. If you have any symptoms on that COVID-19 list, you lead by example. You call work and you say, I have a sore throat. I'm not feeling too bad, but I don't want to take a chance. I want to keep you safe. I'm going to get my COVID-19 test and I'll be back once I get cleared by occupational health. I think it's really powerful to do that. And that tells everyone that you are keeping an eye out for them. You want them to be safe. And that if they have to call out sick to get a COVID test, that they're going to be okay. Planning ahead is really important. We know early on in the pandemic, there's a huge shortage of PPE. And even now, supplies can be a little tough. As much as you can, planning ahead. One thing my institution does that I'm thankful for is, like I said, we get that update on the supply chain. And if they know they only have a month worth of one N95 mask, they contact all of us with that mask. If you were an 1860 small, our supply is running low. We're getting a big shipment of the 1320s, but all of you need to come and get fit tested. That way, we're all fit tested and ready to go before we run out of the old masks. Obviously, predicting your supply use can be difficult and complicated. Fortunately, I found a calculator available on the CDC with references for healthcare providers' infection control that includes with an Excel spreadsheet you can plug in your numbers, and it comes in with a PPE burn rate calculator, which might be helpful for some of you. And I apologize, I realize my slides are not very exciting. I am terrible at PowerPoint and technology. I'm going to try to have some fun stuff on later on. Other things you can do as leaders and managers is allowing more of your workers to work virtually and remotely. And one thing I think has been interesting with this pandemic is how rapidly things have changed and taken place we've always been told couldn't happen. For years, many healthcare workers have asked, can I work remotely? I think I can do my work from home. And I was always, no, 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 HIPAA and security and this and that. And all of a sudden with COVID-19, a lot of us are working virtually and from home. This can help to keep our coworkers safe, who might be at higher risk of infection, and also help those of us who have childcare or other family responsibilities. I think more of us can probably do at least part of our job remotely than we originally thought. As much as you can do to help facilitate this will be appreciated by your team members and help keep them safe. I highly encourage you to emphasize wellness and let your team know that it's important to you. One way you can do this is by including a wellness line item on all your regular meeting agendas. Every month, I have to give an update on wellness to my colleagues at our monthly provider meeting. And it's a way to let them know that this is something that we're always thinking about. At Stanford, we also have a structure of wellness champions, which works really well, and you might want to think about doing it at your institution. Up at the top, we have the head of the wellness program, and then wellness champions at the department, division level, and then in the clinics. So in each group, there are people who are volunteered to be wellness champions. I myself am one for my clinic. We all communicate with each other, and we share information with each other on programs, resources. There's this childcare program. There's this neat thing going on. And my colleagues know they can come to me as a wellness champion, because you can't necessarily, everyone can't keep track of all the resources and things going on, but having local champions who share information with each other can be an effective way to distribute that information. And also, emphasizes the importance of wellness. They have a designated labeled wellness champion. I highly encourage all of you also to have regular check-ins with your team members, whether that's your daily meetings, your weekly, or your monthly. Literally take time out and say, I want to check in and see how everyone is doing. A lot of people are not doing well right now. It is okay to acknowledge that, to give them a space to say that, and to find out how you can support them. It will be incredibly appreciated. It can make a big difference. I already talked a little bit about physical layout in regards to our break room and our lunch space. Eat outside, but then you got to make sure that you have seating outside. What about the rain? Is there a cover? Are the seats spread out far enough? Other things you can do, we've locked several of our doors so that patients will only come in one entrance where they can be screened. The doors are still open to the fire department, obviously. And you can also do good things. Make it easy to do the right thing. At every entrance to our workroom, I've set up little baskets with everything you need. You got your hand sanitizer, you got your gloves, you got your wipes, you got your masks. Make it easy when you come in. You have everything you need right there when you come in and when you come out. Anything you can do to change a physical layout. Obviously, spread your workstations, your computers 6 feet apart. If they're closer than 6 feet apart, people will use them. I was in a meeting with a nurse who ran a clinic where they had a lot of residents, and she's complaining that the resident doctors would use all the computers no matter how many signs she put on them. Do not use this computer. Computer closed for social distancing. She said the doctors are always in a rush. They won't listen to what I say. They keep using the computers. They're not spacing out. And I said, I am so sorry. I'm a doctor and we are impossible to manage. It is like herding cats. So I told her, I said, unplug the computers. And if that doesn't work, you hide the mouse. I know it sounds kind of patronizing, like you're managing kids, but it works great. Whatever you got to do, make the right thing easy to do and the wrong thing hard. I want to take a moment while talking about infection prevention to address the issue of COVID-19 vaccines. Obviously, this is a hot topic in the news. Early on, we're really hopeful. Oh my gosh, once the vaccine comes out, life is going to go back to normal. Since then, more concerns have been raised. People have concerns about the vaccine safety, given how rapidly they're being developed, and some concern for political influence. I myself was extremely happy to hear that last month in October, Gavin Newsom announced a vaccine safety task force. That task force has since been joined by surrounding states, including Oregon, Washington, and Nevada. It consists of several specialists and experts in multiple fields: infectious disease, pediatricians, epidemiologists, vaccine scientists, global health experts, and they're going to review any vaccine that is approved by the FDA under the emergency use authorization and decide for themselves if it is safe before it's distributed to California. There are many people listed. I want to call out 2 people on this panel. One is someone I know personally. Dr. Bonnie Maldonado is a physician at Stanford who's been highly involved in everything COVID. She's an absolute rock star and an expert in this area, and I have a lot of faith, and I was very happy to see her on the panel. Another person I was happy to see, although I do not know them personally, is Dr. Rodney Hood, who's a president and founder of the Multicultural Health Foundation. The Multicultural Health Foundation focuses on community-based and culturally appropriate care. Given our diverse population in California, I'm glad that someone with this perspective has been given a seat on this important board. At this time, early November, I can't tell you if any particular COVID vaccine is safe, but I do feel really good knowing that these experts are going to be approving it before use in California. Once it is approved, it will be targeted towards high-risk groups early on, and then gradually become available to the general public. So I have talked for some time about wellness and a lot of stuff about COVID-19 and especially infection prevention. I realized I did not address a lot of the other issues such as unemployment, financial stress, childcare, politics, those kind of things. I don't have a lot of answers for those things, but I do have suggestions for things that can help you cope with those stressors. This is a section as we call Everyday Wellness. Myself and several of my colleagues put on workshops we call Everyday Wellness conferences across the country for doctors and other healthcare providers. We created this workshop because I saw a problem with what the wellness programs that I saw. A lot of the wellness programs I saw being offered to healthcare professionals were 6-week programs where every Tuesday you met for 2 hours to talk about mindfulness and meditation and practice strategies. And I don't have time to go to something for 2 hours every week for 6 weeks. I got work and I got kids. I don't have time. I need something that I can do in my everyday life. And also, as a busy person, I don't want to do something if there's no evidence for it. What I'm going to show you in Everyday Wellness is we're going to practice several different things that you can do in your clinic tomorrow that have been scientifically proven to improve your wellness. Some of them may work great for you, other ones don't. That's why I'm going to throw a lot of spaghetti at the wall and see what sticks. See what one works for you. So I am still kind of crack up that I give talks on wellness and do wellness workshops because I, at the beginning, was very much anti-wellness. I was like, I don't have the time. I'm too busy. This is just fluffy. I'm just coming to this lecture so I can get my, education hours. And I'm like, this is not my style. I am not like these people. And I also was really worried that if I took time out to exercise or something like that at work, that my boss would think I wasn't working hard enough. Turns out when I started doing these things, my boss joined in and said, this is great. Please keep doing it. We need to take this to other clinics. You'd be surprised how many people want to take care of their wellness. We all think that people around us are going to judge us for not working too hard, but you can be the example of the change you want to see in the world in your own clinic. For wellness strategies to work, you got to take charge of your own wellness. I tell my learners this all the time. No one else is going to watch out for your wellness because of you. You got to make it a priority, and you have to figure out what works for you. We're all in healthcare. We're all used to taking care of patients. We'll come up with patient care plans, figure out what they need. You're your own patient. Figure out what you need, come up with your own care plan, and execute it. And you got to personalize it. What works for you isn't going to work for someone else. I get stressed out by meditation. I know it sounds crazy. There's a ton of evidence meditation is great. I know it is. It doesn't work for me. Other things do. What works for me isn't going to work for you, and vice versa. And again, that's why I'm going to show you a lot of different things, and you can choose what works for you. You got to personalize it. You got to figure out what you can actually do. If the gym is closed, you can't say, I'm going to go weightlifting at the gym 3 times a week. What is realistic in your life? Don't beat yourself up if you're not doing what other people are doing. Do what works for you. I'm hoping after this, basically, that you're going to have practiced with me some techniques, and that you're going to leave with things you can do later today or tomorrow at work. I am going to have links to websites and references and things you can download. And you should have access to these slides as well. Trying to give you really kind of concrete things you can put in your toolbox. First of all, let's talk about music. And I like starting with this one because it kind of shows you that what I'm going to be talking about is maybe different than what you're expecting from a wellness workshop. And I think people are kind of taken aback. They're like, what, music? Like, I can listen to the radio. That's not what I was expecting from this workshop. But I like it for that reason. Music is available to all of us. And music has been shown to be incredibly powerful at its effects on our minds and well-being. It is so powerful that some people have suggested it should be considered as a drug therapy, although one without side effects or drug interactions. There's been many studies done on music in the clinical setting. One looking at perioperative pain management before and after knee surgery showed a significantly decreased amount of opioids that people needed. It's been studied in studies treating people with anxiety, depression, and schizophrenia. It's been studied in studies with functional MRI, looking at its impacts on our brain activity, including our limbic system, which processes emotion and rage. Music is going to affect how you feel and how you think. My boss, who helped us start this, brought up the point, thinking about consciously, what do you listen to on the way to work? If you drive to work or if you ride public transportation and listen to music. She said that she always used to listen to NPR and listen to the news because she felt like she needed to be aware of what was in the world, to be responsible and know what was going on. But that meant before she even stepped in the door to see her panel of patients, she was already tense and worried and thinking about all this stuff. Think about what you listen to on the way to work and what you want to feel like, and adjust your music to help feel that way. We talked about personalizing it with music. You have to do what suits your style. I love Hawaiian music, really chills me out at work. You might not like it. You do need to be respectful of your coworkers. If you can listen to music at work, that is fantastic. You do have to be respectful of your coworkers, obviously. I had a colleague, I still have 2 colleagues. One is from Southern California, in Los Angeles. Big fan of gangster rap, loves gangster rap. And he was playing it at his computer one day relatively quietly. But at the end of his shift, he left and didn't realize he left the music on. The next person to use his computer is another coworker of mine who's also lovely, but she's definitely much more of a Joan Baez person. She couldn't figure out how to turn the gangster rap off and was extremely distressed by it. So I highly encourage you to think about listening to music at work, but again, be respectful of your coworkers. They can actually make a remarkable difference in your emotions. And again, this is something you can do tomorrow. This doesn't take a huge time commitment. I do have to address mindfulness because as much as I don't have the patience for really long meditation practices, mindfulness has been shown in many, many studies to have a big impact on our wellness. One thing that's very effective, especially for those of us in healthcare, is self-compassion. We all are in healthcare to take care of other people. And a lot of times we will care for them and end the day emotionally drained. It's really hard to take care of sick people who are stressed out, who are angry, who are suffering. We need to have as much compassion for ourselves as we have for our patients. One very quick strategy I have learned is a compassionate person exercise, where all I do is 2 breaths. And I do this before I go in the room to see a patient who I'm not looking forward to seeing. It could be someone I know is angry, who's upset, who's maybe going to be emotionally draining. Maybe I'm in a bad mood. Maybe I've had a long day. And we're so used to going in and giving and giving and giving until we don't have anything left. This is a good exercise for those of us who need to reset and remind ourselves that we are important too. Before I go in the room, I take 2 breaths. 1 for me and 1 for you. And that's it. If I need to do it again, I do a second time. It's those 2, that deep breath in, that deep breath out, 1 for me and 1 for you. It reminds me that we're equally important in this relationship and this visit. Like I said, I do want to send you home with a lot of resources and references for things you can do. I realize that 1 breath, 1 for me, 1 for you, for a lot of you is not as much mindfulness and self-compassion as you're interested in. There is a fantastic class that's offered by Berkeley. It is online. Berkeley has what's called the Greater Good Science Center, which is a really neat program. They have a hugely popular free online class called The Science of Happiness that goes into a lot more detail than I just did about what makes us happy. It's hugely popular. It's free. It's online. I have the link here, or you can also just Google Berkeley Science of Happiness and learn a lot more about strategies you can use to be happy. They also have several classes specifically addressing happiness at work, including mindfulness at work, building happy teams, reducing stress at work. Again, here's another link for many of those specifically addressing happiness at work. And for those of you who are interested, several of the classes do offer continuing education credits. Next thing, I call it walk and talk with a colleague. And even if you can't walk, talking with a colleague is good. Many studies have shown that connecting with other people is very important for our well-being. And it seems to be that connecting in person with another human being is much more effective than connecting online. We are social beings, and if we're not connecting with other people, we don't do well, even those of us who are introverts. In order to increase our well-being, though, talking with someone, it's also important what you're talking about and who you're talking with. And again, I encourage you to be conscious in how you're using these wellness strategies to improve your well-being. If you are talking to someone and complaining about your day and your work and your patients and this and that, you're reinforcing those negative thoughts in your brain, and you're probably going to bring the other person down as well. Similarly, if you're talking to someone who's very negative and is always complaining to you, that's going to bring you down. I really encourage you to share positive things and positive feelings with your coworkers or a friend. This does 2 things. First of all, it helps you practice gratitude and reflecting on what's been good that day. And at the same time, you're connecting with another human being, so you're getting more bang for your buck. You're also making their day a little bit better. One thing I try to be really conscious of in my clinic is sharing any patient compliments I get with my team. That's why we do this job. Whenever a patient tells me something good, I share it with the whole team, and it makes a big difference in how we feel. Walking and getting outside is really good as well. So if you can go for a short walk and share some good news with someone, that's even better. I'm going to show this video in a moment. So like I said, walking outside is great. So I want to take a moment and talk about one of my favorite things, which is exposure to nature. So I did a big talk on this a couple years ago and was blown away by the amount of research looking at the importance of exposure to nature on our well-being. We are not meant to sit inside and look at computer screens all day. It really does affect us. There's growing recognition of something we call nature deficiency. There was a whole issue of National Geographic devoted to this a year ago. Exposure to nature is being studied in many conditions, including PTSD. Getting out in nature and seeing natural settings makes a big difference in how your brain works. There's a really interesting study done at Stanford a few years ago that I think is really relevant to us, those of us who work in healthcare. In this, they took a group of volunteers and gave them a cognitive task, testing your brain. And they had them where the volunteers had to remember a certain amount of information while learning new things and processing it. The kind of thinking they had to do was really similar to what we do when we're taking care of patients. They're telling us these things, we're trying to organize it into diagnoses, into treatment plans, remember everything they've told us. Really similar, high-level thinking. Then half of the volunteers went and walked along El Camino Real in Palo Alto for half an hour, and the other volunteer group went and walked for half an hour in a wooded setting. Now, if you know anything about El Camino Real in Palo Alto, it's pretty much storefronts and traffic. No nature, but they're both outside for the same amount of time, same amount of walking. The only thing different was the setting, trees or traffic. Then both groups came back and had to do the same cognitive test. The group that had been walking in the wooded setting had significant improvement in their performance on the cognitive test. The other group did slightly worse. That means that that group that was exposed to nature would do a better job if they were in a patient care setting taking care of patients. And I tell this to my residents. I said, if I could give you something that would help you take care of your patients, would it be unethical of you not to do it? They said, absolutely. If I can take better care of my patients, I should. There's such strong evidence that being exposed to nature helps your thinking process. I argue it is unethical not to do it because you need those skills to take care of your patients. Now, we can't all get outside to go for a stroll in Yosemite. I realize that. Fortunately, our dose of nature doesn't have to be a huge park. It can be even just looking at a natural setting. One study showed that if you can just see a tree out your window, it improves your well-being. So again, I want you to take a moment right now and look at where you are. I'm expecting that where you are is probably where you spend a lot of time. I want you to look around right now in your office, in your house, wherever you are. Can you see any nature? Look at your window. Can you see anything green outside your window? If you can't, is there a tree behind the blinds, behind the curtain? If there is, open the blinds, open the curtain. I know this seems incredibly simple and simplistic. That's one of the first things I do when I teach workshops is I open the curtains. If you can see green out your window, if you can see nature out your window, open the blinds, open the curtains. I want you to be able to see it. Is there any other way you can get nature into your office? Think about it and think about concrete things you can do. One study even showed that having a poster of a natural setting in your office improved your well-being. I know it seems silly, but again, these are all concrete things you can do that have been scientifically proven. I'm going to show you a little video. Just helps to explain how important nature is to us.
Do you find yourself longing for the apocalypse? I did. I was looking for a reason to live. Hi. Are you feeling tired, irritable, stressed out? Well, you might consider nature.
From the people that brought you Getting Outside comes prescription strength Nature, a non-harmful medication shown to relieve the crippling symptoms of modern life.
Nature's recommended for humans of all ages, and it's great for pets too.
This is, I'm going to lead into a section on humor as well. But first, I think it's important to address an issue with that video. The video is funny, but you may have noticed that video was very, 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 very white. And that's the valid and growing criticism of the wellness space and a lot of wellness practices, yoga studios. If you Google wellness, it's a very, very white space. And a lot of people of color don't feel comfortable in those spaces. So I'm going to give you several groups, kind of examples. If you don't feel safe hiking alone, safe running alone, if you don't feel welcomed, you should feel welcomed. No matter your color, you should feel safe and welcome everywhere. I realize that's not always the case. So I want to give you some examples of programs you might want to look into. And there's a lot more out there. I'm just giving you a little taste. First one is Outdoor Afro, which is a nationwide nonprofit group that was started by someone who really liked to hike. And she said, I don't see people like me out there. There are chapters in both San Francisco and Los Angeles. They lead group hikes and meetups all over the Bay Area in Southern California. Down in the Los Angeles area, there's a group called Black Girls Hike LA, and I've included their Instagram address. They're also on Meetup. They have over 1,000 members, and they also do regular hikes all over the Los Angeles area. That can be a great way to learn new hikes and meet new people. In addition to hiking, so we're talking about nature and then hiking, not just hiking. There's probably a lot of you may have heard of the group Black Girls Run, which was started to encourage African-American women in running and support each other. I run races myself. I see a lot of them, and they look like they're having a lot of fun. There's a similar group was started a little bit more recently called Latinos Run. There's a big chapter down in Los Angeles if you're interested in looking into that. I also want to put a little plug in there's a Filipino cook here in the Bay Area who has a nonprofit she calls Astig Vegan, which teaches healthy cooking, healthy Filipino food. You don't have to be Filipino to watch her cooking channels or read her recipes. But I know on the surface, if you go to yoga studios and wellness, a lot of it is people that look like me, but all of us deserve to be well, and there's a lot of stuff out there for all of us. Okay, so I showed you the funny video because I want to talk about humor. And again, everyday wellness, I'm trying to give you short little things you can actually do, not an hour-long workout or an hour-long yoga session, things you can actually do. Humor is one of the best shortcuts to turn around your mood. And again, there is really good scientific evidence behind this. Humor and laughter has been shown to increase your endorphins, decrease your major levels of pain, improve your oxygen levels, relax your muscles, which is great when all of us have this tech neck from sitting at our computers. It improves your immune response, which is fantastic in this time of COVID, decreases your blood pressure, and decreases depression and anxiety. Humor is good. Obviously, if you're sharing humor at work, try to keep it, work appropriate. I personally like to put a lot of the funny stuff in my emails, with this visibility wall to tell this boring statistics. I found if you put humor in your emails or on a visibility wall, people are much more likely to look at it. This is one example of a funny, medical humor site called Gomer Blog. This is an example of this is a fake article. There's not, in fact, a 10-foot stethoscope to keep you safe from patients of COVID. They have funny stuff like that. Okay. Exercise. You knew you could not go through a wellness talk without a section on exercise. Partly because if you don't realize that exercise is good for your health, I don't know where you've been. Exercise does not have to mean putting on a special outfit, paying for a class, doing something you hate. I'm going to try to give you, again, links here to stuff you can do. First of all, really important, I think, for all of us, especially in these times, we're on the computer all the time, all day. We're all getting neck and back and shoulder pain from being on the computer. You're probably getting it from being on the webinar right now watching. One of my medical assistants shared this with me years ago. It's a set of stretches specifically designed for those of us who are at desks all day, and you can do it in your office. I have found it to be so helpful. You can literally tell where I've worked because every clinic I've worked in has this on the wall. When I'm working at our COVID-19 drive-through at 3 p.m., I make the entire gym pause and I lead them in this stretching exercise. And if you come to the COVID-19 drive-through when I'm working, the patients half the time they join in. And it seems silly. Afterwards, so many coworkers come up and say, "Oh my God, thank you. I feel energized. I feel so much better." So I don't have the time to do the whole thing, but we're going to do a little bit because we've been sitting here for like 50 minutes and we're getting stiff. And you can print this out. Stick it in your office, do it. Put it on your phone. I have on my phone every day at 3 p.m. my alarm goes off and it tells me to stretch. You got to do it, make it easy, remind yourself to do it. When you do the stretches, you're going to do it for about 15 seconds each. Stretch forward. And like I said, this is usually a hands-on workshop. I really, really, really hope you're doing this with me because it feels really awkward to exercise in front of a web camera on your own. You're going to stretch back. I'm not going to make you do the whole thing because we don't have time. But when you're done, or even pause it now, do all of these. It's going to make a big difference. My chiropractor colleagues tell me they're incredibly busy now. Everyone's coming in with neck and back and shoulder pain. They're even seeing kids coming in for being on Zoom for too long. Investing in regular stretching every day can help to prevent that. I don't think I have time to show you this video, but this is about, it wants you to watch the video. Don't play the video. Okay. That was about something called the 7-minute workout. Some of you may have heard of it. I know it sounds incredibly cheesy. It's like 30-second beach abs or something like that. I was introduced to it several years ago and liked it so much. And this is what got me into the wellness space. Is I wanted to start doing this at lunch at work because by the time I come home from work, I am too tired. I got to help my kids with homework. I got to get dinner, and then it's bedtime. If I don't exercise during the day or in the morning, it's not going to happen. My sister showed this to me, and I'm like, okay, if I can't do 7 minutes, I can do 7 minutes at lunch. And I was afraid that doing that at lunch, that my boss was going to think I wasn't working hard enough. And she was the opposite. She's like, oh my God, I want to come join you. We actually ended up basically have a big group at lunch not every day, but the days I'm working, we have about 8 people go out. It's a little harder in the pandemic, but going regularly. It's 7 minutes. You can find, and even when you're tired, like it's always, I can do 7 minutes. And I know it seems cheesy and how can 7 minutes work? It was actually pretty scientifically designed to be as effective as possible in 7 minutes. It was designed by the Human Performance Institute in Florida. It's an example of high-intensity interval training, but you can do it in your work clothes. I do it in my blouse and pants and loafers all the time. You're going to alternate basically moving, some cardio, along with lower body, upper body, and abdominal core exercises. And because you're rotating, one part is recovering when another part is working so you can keep going. So you get really the maximum benefit in the smallest amount of time. I didn't really believe that you could really make a difference in 7 minutes, but workouts like this have actually been shown to improve your insulin sensitivity, lower your blood sugar, and improve your cholesterol if you do them regularly. Again, it's 7 minutes. Think about printing this one out as well. And what you do each thing for 30 seconds and about 10 seconds in between rest. There are a ton of apps that basically have it. You can just look up 7-minute workout apps. I don't endorse any particular ones. Like I said, no conflicts of interest. A lot of them are free. So at lunchtime, I go out, pull up my app, I hit the button, and we start doing it. Very effective. It is only 7 minutes, and you do everything. I really want to give you things you can actually do at work, nothing crazy. The last thing we're going to talk about, I learned from one of my Dutch colleagues who teaches at the University of Maastricht, who's given this lecture with us before. I will probably mispronounce the Dutch word, geluk. It's a Dutch word for what they call moments of happiness or mini vacations. And I like to end with this one because it reminds us again that we need to take responsibility for our own wellness and be strategic about it. So I want you may want to pause the webinar. I really encourage you to do that and do this now. And make a list of about a handful of things that make you happy in your everyday life. And one thing you can do if you're having a hard time is think about what did you enjoy this week? And again, we're talking about small things that you can do. I love Hawaii. I would love to go on a vacation to Hawaii. But we're thinking about things like what happened today that made you happy. Write those down. Then, planning. And this is a time to put it on your phone. I hope you put down every day your desk stretch, your exercise. I want you to plan 3 mini vacations per week. Again, not big. Even 20 minutes is something that brings you joy. Maybe that's knitting. Maybe that's reading. Maybe that's playing with your dog. Maybe it's writing. Maybe it's gardening. What do you enjoy? You need to make yourself a priority. 20 minutes, fit it in. Get out your calendar now. And just like you'd put things in for your work meetings, your work shifts, your doctor's appointments, all those things. I got to drop my kid off at school. I need to go to the grocery store. I need to do this. I do this. Only 3 times in the week. I want you to put down 3 20-minute slots, maybe 20 minutes on a Wednesday and 20 minutes on a Saturday here and on a Monday. And plan those things. And those are for you and only for you. They're not for other people. You're not doing it to make other people happy because it makes you look cool, because someone wants you to do it, because it's going to make you look a certain way. No, only things that make you happy. If you want to read the trashiest murder mystery novel ever, go for it. You want to, bake whatever makes you happy and only you. Put those on your calendar. Only 20 minutes. It doesn't have to be long. Fit it in. Make yourself a priority. So think about what you're going to do. So in summary, I hope I've shown you several things that you can do in your everyday life that are doable. Listen to music, practice self-compassion, think about some of those online classes at Berkeley. Go for a walk, talk with your colleagues, and share positive things, which makes you feel better and makes them feel better. Exercise, even if it's stretching, 7-minute workout, running, Zumba, dancing. If you're moving, it's exercise. Being out in nature, exposed in any way. And reflection, thinking about what makes you happy and being strategic about making those things happen in your life. I hope you enjoyed the webinar. I hope it was helpful. I know it's incredibly stressful times, but we're all in this together. We all need to support each other. And I very much wish you the best. Have a great day.